Good evening, everyone. Today we are going to start Unit 8, that is Information Technology in Health Insurance. So, what is this information technology in health insurance? Health insurance operations like essentially deal with overall coordination of various processes which are uh, meant for or which are important for creation, distribution, and servicing of health insurance business. Okay, throughout this process, offering quality services are very important in the health insurance operation. So, health insurance operations should ensure the integration, as well as it should also have good factors that will impact a dynamic business in the environment. So we will check. So what is this health insurance? And so here coming to your meaning of information technology. So this uh, device and technique used to store, to process, to manage, and to communicate information such as computing or telecommunication is known as information technology. Yes, nowadays, if you see like in the present scenario, everyone are using computer one way or the other, and it is like a very good advantage for the uh, in the information technology in the health insurance, because it helps in capturing, storing, and processing and managing the data, and also it is important to communicate the information. And this health insurance companies are using this information technologies for the better customer services, and for the cost reduction, and for the new product designs, and for the development of the health insurance, etc. And next, we will see what is this need for IT in health insurance operation. So the need for IT in health insurance operations is like main thing is one of the most significant benefit of technology in the health insurance operates is main automation of routine tasks, and with the implementation of electronic health records, claims, the processing and billing related to the health insurance premiums can all be done efficiently, effectively, and accurately. Where with this process, where it will reduce the risk, it will reduce the errors, and also it will reduce the fraud issues. And this information technology mainly it will provide a scope to the insurers to streamline their operations, and they also bring good utilization of resources. And this health insurance mainly it firms, and it will mainly coordinate not only with the customers but also in distributing the channels to the network hospitals, and to the third party administrators, to the healthcare providers, to the regulators, etc. And when if you see, whereas like this IT, it will provide a good face to communicate and take part in a good team spirit. Yes, nowadays if you take this information technology plays an important role in communication. With the effective communication, this also helps to build a good team spirit between the insurance company and the policy holder, not only with the insurance company and also with the agents, brokers, or with the third party administrators. And this will bring good utilization in the resources also. And next, coming to the role of information technology in health insurance operations. So, what is this role of information technology in health insurance operation? Is first, like we have few things like as marketing, underwriting, claim process, actuarial and rate marketing, and last one is management information system, enterprise resource planning, data and data centers, and data analytics. So here first we will see what is this marketing. So if you see in marketing, how this role of information technology in health insurance operation is important. So if you see here, the customer survey is done, and marketing research is done using this IT applications. Like if you see the statistical analysis system software, okay, with the help of this statistical analysis system software, and you also have this ECRM applications. So what does this ECRM applications do is they are, and these are developed by your software companies, and these are used by the health insurance companies mainly to see that the customer communication is done in the right time and it is done in a right place. And this, if you see in this, the digital marketing, the social media marketing are a part of the uh, modern business promotion. Yes, nowadays if you see, digital marketing is like being a main thing that is going on in the society, and also with this social media organization. And some of the policies, if you see, they are purchased under online basis only, okay, because of this good technology of this health insurance operations. And next, coming to the underwriting. So what is this underwriting? In this underwriting, there is a process of classification by selecting the risk, and also by deciding whether to give the insurance or not after doing this underwriting. And next, they will finalize the terms, they will finalize the premiums according to the terms and condition. And this underwriting is a very critical and a crucial role in the insurance business. And this IT applications are important in carrying out this underwriting. Once the details are entered in the underwriting application, it will be analyzed whether there is risk or not, whether they will verify, they will validate, and they will, once it is validate, if the uh, policy holder will get a insurance policy, then they'll calculate the premiums. So that time, if you see, so the time that is consumed for the entire process is reduced, because this also help in the tracking the renewals, the premium, medical history, etc. Okay, if you see whatever like verification, previously we have in detail read about this underwriting. So throughout this verification and this entire process, with the help of this information technology, this also helps in the process of underwriting. And also not only with the help of this underwriting, but it is also help in tracking the policy holders to check the renewals, whether they are made or not, and what are the medical history, etc. And next, coming to the claim process. Coming to the claim process. So in this claim process here, if you see, main thing is say claim settlements. Okay, main thing we will see here is a claim settlements. And this IT system, if we see this IT systems, as we discussed, these are effective mainly to determine whether the claim is genuine or not, whether it is genuine or not, whether it is fraud, whether the claims are payable. Everything is calculated with the help of information technology. And nowadays, if you see, the systems are so designed so well that all the claims payment functionings, whether any losses are there, whether any fraud claims are there, everything can be detected. And also, if you see, like the persons involved can also be kept under the blacklisted, which, whereas this information is important for the other people whoever are estimating the details of the certain policy holder. And next one is this actuarial and rate making. So here, if you see, this will estimate the future losses. Okay, mainly this actuarial and rate making. What does it do is mainly this will estimate the future losses, and this is also used to determine the lowest premiums that meets all the objectives of the insurance company. Mainly, the software is available for the better informed decisions like estimated loss. It will check the mainly this IT will help us to, the software will help us to get better decisions related to the estimated loss, what is the estimated loss, and what are the claims reserved, and what are the underwriting results, whether the person policy holder is getting the uh, whether he's able to claim the process or not, and what are the calculations done under the policy, and what is the large volume data that is. Okay, so that can be in the rate making. So if you see here, the large volume data are processed by IT systems mainly to support the operations, because we should collect n number of data and a very huge amount of volume of data from the policy holders and also from the uh, network of hospitals. So this IT will help us and this will support the operations and the other functions like not only this functions which we discussed, but this also will help to send the reminders to the policy holders about the renewal policies, okay, about the renewal date, and to issue the invoices, a final documentation, and maintenance of the records and storage are part of IT applications if you see in this health insurances. And the last one is management insurance system, enterprise resource planning, data centers, and data analytics. So what is this all about? These are also widely used in health insurance industry, mainly this IT applications like they will be providing approaches to the insurance operation, and mainly this will provide convenience in making the work very easier for the clients, for the employees, and for the customers also. So these are the role of information technology in the health insurance operations. And next, coming to the validations. So what is this validation? Okay, this validation is nothing but it is an authenticate or to confirm or to verify. Mainly here we just confirm something that is true and that is correct. Okay, and mainly here if you check, there is one good example, like for example, you enter your new password whenever you like to try to uh, type a new password. Okay, and again what happens is, again for the second time you get, okay, for the second time also again you just type your new password for the confirmation, or that is nothing but validation. Okay, that is nothing but your validation. You enter your new password for the second time. Okay, first time you already type, again for second time also the password is being asked, so it is nothing but it is being asked for validation and for the confirmation. That is called as validation. And this validation data mainly it will make sure that data is clear, it is accurate, and it is usable for the person whoever the information has been validated. And only this validated data should be updated. Okay, always whatever the verified or confirmed data that is there related to the policy holder or related the information from the network of hospital, always it should be updated, it should be saved, and it should be used. Otherwise it can cause error in the information, and this validation plays an important role, a critical role, or a crucial step in the insurance industry, because where this will ensure the insurance policy offers by like healthcare providers, and this information should always be accurate, always be reliable, and always it should be up to dated. Okay, and this if you see in this insurance verification process, okay, this validation also have a verification process where it is an essential part in the validation process as I explained, and this will help us to collect all the necessary patient information in the validation or the verification. If you see in the verification, they will ask the full name of the policy holder. They may ask what is the date of birth, what is the um, uh, uh, social security number, or they will ask you the insurance details. They will ask you the insurance card details, the card numbers. Okay, these all are nothing but for the validation and for the verification. And this insurance companies, if you see, they are bound to make certain details. Okay, whether you are collecting the information or whether you are giving the information in a correct way by the policy holder. Okay, and next in this validation, like you have two types of systems, that is validation and verification. So in the validation, as we like discussed, it is required to check the data that is entered in the system, and this is done at the time of the data entry. Whenever you enter the data, validation is done. Like example, I've given you the password example. Okay, and next one is the verification. Here verification is nothing but confirmation and submission of more proofs that are related to the policy holder. And in insurance, large data is collected and important data is collected, whereas this data should be undertaken for validation. That's why, like if you check in the digits, okay, sometimes you check the digits, the spell check, format check, and the length check, and you can like have a range check, etc. So any mismatch in the data information could prove a very costly mistake, where this mistake have to be bared by the insurance company. So online frauds, if you see this, online frauds, hacking, and unauthorized users have become more, like you see so many fraud cases related to this online frauds, hacking, etc. So with help of this validation, it just prevents this online fraud and hacking and unauthorized users, because you only know what is the password of it, and you only have to like confirm the second time when they are asking you. So this all data, whatever it is related, it is important for validation about the patient history and patient information. And next, coming to the operational efficiency. So what is this operational efficiency is like the, in this efficiency or in this health insurance, mainly this is possible using in the IT technology, and it is efficiency, and also it is very productivity. Whereas here, if you see, careful planning is important, and efforts of building the efficiency should be taken up to achieve the operational efficiency, and this requires always an updating the software, hardware, and IT companies. Okay, operational efficiency is very very important, and mainly this will require the upgrading the software of the hardware and the IT components. So like you have certain components. First, like we have this optimizing business services. Okay, what is this optimizing business services? If you see, uh, this optimizing business services are to identify, okay, and to know the after identify, we have to implement a new method. Okay, you have to implement a new method, and then because after you implement a new method, a good method, that is important, this will help in a growth of the business, and it will be more efficient and related to the cost effect. And this mainly, if you see this optimizing business services, this is like to introduce a new method to the practices and to the system, and this also will reduce your round time, because this makes your work very easily, because this will reduce the cost while improving your performance in the operational efficiency. And next one is this re-engineering. So what is this re-engineering? This re means resident engineer. Okay, the RE is nothing but resident engineering. So mainly this is to practice, and this is to analyze, and this also will help to design and manifest the pre-existing software system in this re-engineering. Mainly the goal of this re-engineering is nothing but to provide a good quality and to perform and maintain a good health services to the people, and this will help in the cost saving. If you see, this re-engineering will help in the cost saving, okay, by reducing certain amount. And also, main thing, one thing you have to remember in this re-engineering, that is resident engineering, is mainly they will check for checking the quality performance, okay, and quality maintenance. And next, coming to this emphasis to improve experiences. So what is this emphasis to improve efficiencies? Mainly here, if you check in others, you have certain the other details also in this emphasis to improve experiences. You have certain points here. So here, if you see this insurance visibility by using the data. So what is this insurance visibility by using the data? Best method or remaining way to improve the efficiency is through collecting the data, or by the data visibility. With this data visibility, the companies can track their operations in the real time whenever they need it. And they will also help to identify the production, and after identifying the problem that is there in the production, immediately it should be eliminated. The problem should be eliminated, and finally we should meet the plans. We should meet the plans that is be uh, operationally efficient. And next, if you see, stay focused more on business needs and technology. So what is this staying focused? If you see here, in this operational efficiency, this will help us to say stay focused on the customers. Okay, this will help us to stay focused on the uh, customers. And mainly here, if you check like this, technologies should be customized to serve the customers, but not the other way. For example, if you see the earlier in like easily companies cannot adopt it, right? Uh, just because a new technology in the market. Okay, here one point like we can say is stay focused more on business needs than technology. So you have to depend, or you should have a need of your technology, but at the same time you should be focused on your business needs rather than technologies, because most of the companies, because most of the uh, workers in the company, like they cannot adopt a new technology, right? They cannot adopt a new technology in the market. So whereas business needs should be focused in such issues. And next is understand a stakeholder need. So what is a stakeholder? Whom you will call a stakeholder is nothing but a party or a person or a group or an organization that have an interest in a company in taking a decision making activities of certain business. That is called as a stakeholders. It may be a person, it may be a group, it may be an organization, or it may be a party. Okay, that where a person will have interest in a business, in having a decision making in activities of a business. So connecting with these people are very good, which they will help to understand need and support the goals of the uh, operational efficiency. And next is to adopt cloud technology. Now what is this to adopt cloud? This is cloud technology. We all are adopted to this cloud technology. If you take this example, because first we will see what is this cloud technology. Mainly this is to deliver, okay, in one word, if you tell this is to deliver the computing services. Yes, like services, if you take like storage, the databases, the networking, the software, the intelligence. Mainly here the thing is to offer the faster innovation with the help of this IT technology. And this is also possible to save the files to remote it or to save, etc. Mainly, for example, if you see examples which we use in our mobile, that is like Google Drive, Drop Box, okay, OneDrive, etc. These all are certain examples of the to cloud technology. And next one, we will see focus more and more on automation. So what is this focusing more and more on automation? It is like nothing but if you take application of technology where the program to achieve the outcome with the minimal human output. If you take one example of robotic surgeries, okay, robotic surgery. So here in this robotic surgeries, what is happening? They are applying the technology, and they are seeing, they are checking that they will get a possible outcome with minimal human output. Okay, because they don't be, if you see in the robotic surgery, too many people are not involved in the surgery. Okay, only with your that is automation, and that is with your operational efficiency of the IT. What you do is you will take help of a robot and you will just minimize the human output. Okay, nowadays if you take if you check, like you have also self-driven vehicles also, right? Self-driven vehicles where it is reducing the human output. Okay, human output. Here if you see in this insurance, the increase in automation in the IT application will help in the insurance firms by reducing the human errors. Okay, when you focus on this like automation, this will help us to reduce or decrease the human errors. And next one is to develop a unique innovative model. So what is this to develop a unique? Always a uniqueness is important. Innovative creativity is very very important in designing a new products, right? So here the same thing in this, develop a unique innovative model. So what actually happens in this model is the role of an IT is IT in insurance is almost all evolved from over a period of time. Because if you see this this should be developed by a very good leader in operations or in an organization where it is important to have a new idea to transform a new idea. Creative ideas are important to design a new model. Okay, this is to develop a unique innovative model. And the last one is to empower team members to excel. Yes, in order to succeed and very good operational efficiency, team members, empowering the team members is also very, very important for the to reach the excellence. Here, if you see, by paying attention, yes, towards the team members, okay, paying attention is important. Communicating is important, okay, because communicate will develop or it will establish a trust, a bond, okay, and mainly it also help us to develop certain a positive work culture, right? When you have a good communication, okay, when a third party administrator or an agent, okay, is talking with a customer, or you take with the policy holder, what happens here is, in the communication here, if you take when a good communication expectations are there, they will develop a good positive uh, relationship where this will inspire the, or it will help, or it will empower the whole team members. And next, if you see, this should allow the team members to share, okay, always the team members, okay, not only a team leader will always be dominating, but always the team members, we have to give opportunity to share their strengths, their observation, and also we should know whether they have any new ideas with the projects, because when you do all this, okay, focusing their strength and observation and knowing on new things or creativity things also, this will uh, help in the operational efficiency. And next, if you see this IT interface and architecture, so what is this IT interface and architecture? Mainly here, the entryways are very, very important. Here, if you see, the in the insurance companies can easily connect with the software platforms with their third party solutions, such as like data analytics, the tools, the customer relationship management systems, okay, and as you all know, this artificial intelligence, okay, technologies, these all whatever we discuss, like system management, AI, that is artificial intelligence. And if you see the tool customer, the relationship of um, customer management services, okay, this will all help us to know about a better customer, to provide a better customer service, and this will also reduce the cost, and it will help in like building a new product designs, etc. So as I said, like entryways are very, very important. So the entryways are nothing but they are like a window which offers the policy holder, the specialist for communication or request, okay, because as we discussed in the previous thing also, communication is very, very important important to develop the customer's first attitude, right? The first customer attitude is nothing but the outcome that you get from your client's experience, okay, that you get from your client's experience, and it should be a good positive outcome. And next one is web enabled platform. So what is this web enabled platform? Mainly here we have to talk about digital insurance platform. Okay, this web enabled platforms are nothing but your digital insurance platform. Mainly this is referred to the insurance agency protection. Okay, why this web enabled platforms are there? Mainly to safeguard, or mainly to protect, yes, mainly this will refer the insurance agency operations to protect their model based on the IT first approach to improve this internal operations, where if you see like web enabled platforms plays an important role, a crucial role in like new digital technologies, because this will change the way the customer will interact with the insurers, okay. And as we discussed from this three subtopics, like this, communication is important. Yes, communication plays a key factor where the insurance companies have certain tools, because they have to discuss, and how they can discuss or how they can communicate with this insureds are like with the tools like such as websites, okay, having a proper website, applications, email addresses, and social media, and like conducting certain live events and chat text, texting the messages related to the channels, and all these are okay when you have such type of communication like websites, application, email ID, social media, okay, conducting a live program. So these all digital channels will help to reach out the customer, okay, in the web enabled platform. Whereas we discussed that communication is important through certain media. And next is like always you should have a platform, a digital insurance platform. This is a very good like a platform where this insurance agency operations have been based on the technology. That is the first approach that you do. And next here you have a HIPAA, that is Health Insurance Portability and Accountability Act. Okay, so this act was like established in 1996, and this is nothing but this HIPAA is nothing but it is a security, it is a privacy regulations. Okay, you have certain securities and you have certain privacy regulations where certain information should be confidential. Okay, this is a security, nothing but this is a security you can talk about. And also it will mainly maintains like a privacy regulations required, especially to provide or to protect sensitive patient information, sensitive patient health information. So whatever the information that you get from your patient or from the network of hospital, it should not be discussed. Okay, it should not be discussed with the co-workers or with the friends. Okay, mainly this will like simply address the requirements for handling the protected health information. Okay, and this patient information need to be kept very private or confidential. If you're talking with your friends, with your family members, or with your co-workers, okay, this leads to violation. Okay, this leads to violation according to this health insurance Portability and Accountability Act. Mainly here, employees can't share patient information with the friends, with the family members, or with the third party vendors. Whatever the information that you get, it should be confidential related to the claims or forms of the health insurance. So these are some of the things related to the information technology in health insurance. Thank you.